So the country in talks about a third wave of the COVID-19 infections. There are warnings about the situation in the Northern Cape. So data collected from or up to the 15th of May shows an 8.5% of people, or 8.5% of people who've recently got tested until then did actually test positive for the virus. That was up 1.3% from a number the previous week. To expand on this, let's speak to Professor Adrian Puren. He's with the National Institute for Communicable Diseases. Always good to speak to you, Prof. So I'm looking at these numbers here, and you say that the Northern Cape has the highest positivity rate, that's test positivity, at 24%. Put that in context for us.
So that in AC means that 1 in 4 persons that are tested in the Northern Cape are actually positive. And so you can just imagine that, in fact, those numbers are probably higher, or that positivity rate may well be higher. So it's really critical, and I'm sure provinces are working towards this, is really try and increase their capacity to be able to test, to really get a true picture of what's actually happening in their particular provinces. Because that will be really important if you think about what we experienced in the second resurgence or second wave, where again you need to plan with regard to the hospital beds, oxygen, and in terms of ICU capacity as well. So this is really a critical time, I'm sure, for all the provinces, but in particular a province such as the Northern Cape, which has essentially not come out of its resurgence. In fact, it's persistently remained in the second wave, if you like, with a very high incidence compared to the other provinces.
And why is that? Why has it remained, whereas most of the country has gone in and out of what we're now counting to be 3 waves at this point?
Yeah, so I think that's an important consideration. I'm not aware. I think there are pieces of evidence around possibly events or clusters that may have well contributed to that. But I presume that these clusters certainly expanded beyond that, in fact, and led to persistent community spread. And of course, what is really critical then is to have your track isolation policies in place. Perhaps again, if you start having large numbers, which is what is being experienced in the Northern Cape, those systems may well be overwhelmed, and it becomes very difficult then to try and manage your track and isolation processes.
Something that you at the NICD have flagged with the Northern Cape is that the rate of infection is particularly worrying in people aged 55 and older. Do we know why they, in particular, seem to be getting more sick? Well, not more sick, but more of them are sick.
Well, I think it's really the pattern that we certainly have seen in all the waves. It essentially is that those are the older age groups are more vulnerable to infections and vulnerable to more severe disease. Again, in combination with comorbidities, as you know, with hypertension, diabetes, and so forth, that is the likely contributors for what we are currently seeing in those particular age groups. So we're seeing, and that's not going to be unique to the Northern Cape. I'm sure as the third wave takes off in the different provinces, and I've seen a really sharp inflection in the case of Gauteng, that in fact, if we don't stymie this particular third wave, we will certainly then see hospital admissions going up at a rapid rate, and the individuals that will be in those hospitals are really those individuals in the old age groups with comorbidities. So in fact, I really would like to encourage individuals who have the opportunities to be vaccinated, especially in those age groups, because that's what is being targeted at this time, actually avail themselves for a vaccine.
But the tricky thing with the vaccinations, Prof, is that provinces, the smaller provinces, shall we call them, also aren't receiving as many doses as, say, Gauteng, for example. So that will have to be boosted in an area like the Northern Cape, where we are seeing the elderly already taking strain.
Absolutely. So I'm sure the Department of Health, it's not always a simple matter. You're quite right in terms of how vaccines are distributed, where to distribute them, and what decisions have to be made, especially in situations where you have a province like the Northern Cape with really high incidence and higher risks of hospital admissions and ICU requirements. How do you then target that particular province in order to roll out vaccinations? Because I think it's really been well demonstrated in several countries now that even though you may have waves or resurgences, implementing an effective rapid vaccine program can certainly be quite a lifesaver.
Should I get a sense of your concern, your worry about the situation in the Free State? I was looking at numbers out last night. Of the 151 deaths reported last night, majority of them, 72, were in the Free State. What's going on there?
So again, I think in these particular provinces, I think it's really critical. I suppose one could direct those questions more specifically. But again, our concern is, what's actually happening within those particular provinces for us to try and ensure that we can try and limit the numbers of cases as best as possible. I know I've spoken about the vaccine, but in SE, because our program has only just started off, it still comes back to how can we engage with our communities around managing their risk. In other words, it comes back to the non-pharmaceutical interventions, I'm afraid. It's the wearing of masks, wearing them appropriately, physical distancing. We're entering now into winter as well, so congregant events are certainly going to be possibly a contributor to that. Ventilation, or the lack thereof, may all be factors that will contribute to that. Try and avoid large-scale events, keep the events as small as possible in order for us to try and lessen transmission as best as possible.
Do you think, Prof, we pay enough attention to the spread of the virus in the, shall I call them, non-mainstream provinces? Because there's very often quick media attention and all experts analysing when we see a rise in infections in Gauteng, KZN and the Western Cape. And I'm wondering if we're not, to a degree, ignoring the situation in provinces like the Free State and the Northern Cape until it becomes so concerning that we can't overlook it.
So each province essentially has to draw up its resurgence plan. So each province really has to be ready regardless of where they are in the state of the epidemic. And so it's really incumbent upon the provinces to be able to say, well, if we do experience an event, what will we be able to do? But you're quite right. Very often there's been this so-called geographic focus on, let's say, the start in the coastal provinces, such as the Eastern Cape and the Western Cape, for example. As you know, that's where we had those initial first and second resurgences happening, and not so much on the so-called inland provinces. But you're quite right. Perhaps we need to be jolted into thinking, how do we now respond, and respond rapidly, and what are our options and choices? Because, again, I think the Department of Health and I think the Advisory Committee have also noted these increases in cases countrywide. And so what are their options with regard to how to manage the current rates of transmission in those provinces?
Professor Adrian Puren with the National Institute for Communicable Diseases. Good to speak to you, sir. Thank you.